it correct, AFINet's 21st webinar already. And I guess all of the people who are here today know that AFINet is a small charity aiming to bring together researchers, experts by experience, policymakers, and practitioners to promote the well-being of family members affected by addiction. And we are very glad that especially Richard Wellman is organizing this wonderful series of webinars. And as you might have seen when you received the email with the access to this webinar, of course, participation in webinars is free, but we would be happy if people who feel they're able to would donate something in order to, well, cover the costs associated with our website. And I would also like to take the opportunity to announce the, hopefully, or quite certain, our Real World Conference, which will take place next year from June 15 to 16 with some workshops on Saturday the 17th in Rotterdam. And hopefully we will open abstract submission this week. And it would be great to see all of you in the real world and not only on the interface of my computer. Yeah, now I'm very happy to introduce Daniela Capitanucci and Maria Anna Donati from Italy. Daniela is a psychological psychotherapist, forensic criminologist, and former contract lecturer in social psychology at the School of Medicine at the University of Insubria Varese, and member of the Gambling Observatory at the Italian Ministry of Health in Rome. And well, she has a long history on focusing on pathological gambling issues, and she is conducting clinical activity, and she's specialized in training, preventive interventions, research, and advocacy. In 2003, she founded the Association AND, Azzardo e Nuove Dipendenze, on gambling and new addictions, and she's been president until 2012 and from 2021 on. And she designed and contributed to numerous training activities about pathological gambling. And one of her main research interests is not only the clinical management of people affected by gambling disorder, but also on their family members. And also in the area of environmental and educational prevention, advocacy actions, and contrasting policies to protect public health. She will start the presentation, then she will hand over to Mariana Donati, who is an assistant professor of psychometrics at the Department of Neuroscience, Psychology, Drug and Child Health, section of psychology at the University of Florence. And her research focuses on psychological assessments in the field of gambling and video gaming and related psychological constructs. And in particular, she is interested in the development and validation of instruments. This is why she will also take over the method section. And also in the evaluation of preventive or training interventions and in testing empirical evidence of explanation models with respect to problematic behaviors with a special focus on youth. And so I'm very happy to hand over. The topic today will be affected family members of disordered gamblers during the COVID-19 pandemic in Italy during the lockdown. So The topic is very up to date, and I'm happy to hand over to Daniela. You'll have 40 minutes, and afterwards there will be space for debate, as always. So the floor is yours, Daniela.
Okay, thank you very much, Gallus, for this presentation, and thank you to AFINet and Richard for the invitation to this webinar. I'll start right away with an introduction. First of all, I want to present you all our research group, Mariana Donati, who's here with me today, but also Carola Beccari, Caterina Primi, who works at the University of Florence, Roberta Smagnotto, that works with me in Andazar de Nuove Dipendenze, and Eleonora Quadrelli and Alfredo Casini, who works in a sanitary service of addiction in Liguria. Out of this research came an article, which is this one, that it will be available for everyone who's interested to go deeper respect to what we can be talking about today. First of all, I want to introduce you a little bit the situation in Italy to be able to understand what happened during COVID-19 lockdown. In Italy, there was a strong rise of gambling accessibility since 2003 up till 2021, in spending money on gambling, in participation on gambling of people, in prevalence of gambling disorder rates, and also in gambling-related harm that, of course, have increased. Italy nowadays is the largest gambling market in Europe and the fourth largest market in the world after the United States, China, and Japan. Just to give you one data that is important, total gross gambling revenue in 2019 in Italy was 10% of final Italian total consumption and 6% of Italian gross domestic product. It was very impressive, the very, very sharp increase that in a few decades we could assist. As you can see, both in gambling consumption and final consumption, and from gambling gross domestic product. About epidemiology, we had a research in 2019 that showed that in Italy, 3% of the population, both adult and underage, have lost control over the gambling behavior and can be considered disordered gamblers. So our prevalence rate is 3%, minors and adults. About what happened in Italy as pandemic COVID-19, we assisted all over the world, of course, to a pandemic evolution. But what we can say is that Italy was one of the countries that was most affected by COVID-19 in Europe, for sure. Because the situation was very, very tough, our government decided a very strict policy, and we had a national level of stay-at-home message from March 9th 2020 up till June 19th, 2020. This was very, very strict. It is important to describe a little bit what happened, because this can make understandable also our research, because individual freedom of movement in this period was limited totally, because only indispensable activities were allowed throughout the entire country, only indispensable. Um, all the unnecessary activities were shut down, including, of course, gambling land-based offers. And people couldn't go out their home. They had to stay at home unless they had very important reasons. So to go to work, to go to the doctor, but this was enforced by police, who was checking also in the streets if you were really going where you were supposed to go. This for about 3 months. So this situation resulted in a generalized unavailability of most land-based gambling, particularly electronic gambling machines, which is the prevalent game practiced by Italian pathological gamblers, patients, and also lotto drawings, sports bettings, and a lot of other gambling offers were shut down. In this graph, you can see that the red part is the closure, and you can see that from March 2020 till mid-June 2020, bingo halls, casinos, betting shops, slot machines were totally closed, as well as sport betting and other betting games. Note that instead scratch cards and online gambling remained available for all this period. We like to cite what Jim Orford stated about the reasons for harm that are complex and multifactorial. And he said, the more the product is supplied in an accessible form, the greater the consumption and the greater the incidence. So lockdown was the worst, biggest psychological experience, because in Italy, at least, poof, in one day from another, no more gambling on site was available. Several studies focused on behavioral and psychological effects connected with the decreased availability of chance-based gambling games and with the reduced exposure to land-based gambling offerings on the general population, on gamblers' population, and on disordered gamblers' population. But we wanted to know what happened to gamblers' relatives, the affected family members of gamblers who were treated by the services of health. And we perceived that there was little attention given to what was going on to these people and to the families of people in treatment for a gambling disorder. So our research questions, our main research, was to understand whether these particular environmental contextual factors due to the COVID-19 global pandemic during lockdown acted as a risk or as a protective variable for addicted family members of disordered gamblers in treatment. Our goals were to investigate the psychological state of disordered gamblers, addiction family members during the COVID-19 lockdown in Italy, that period of 3 months totally at home, to understand if the unavailability of most land-based gambling offerings during the lockdown created a relief for affected family members, to compare affected family members to their relative with a gambling disorder in relation of the quality of family relationships and emotional state during the lockdown. Now I leave the speech to Marianna.
Thank you, Daniela. Can you hear me?
Yes.
First of all, I would like to thank AFINet for organizing this webinar and for inviting me. The research I'm going to present you is one of the works that we have conducted in collaboration with Daniela's association, trying to integrate research and practice. I would also say sorry to you for my English. And so let's start with my presentation that will be focused on some methodological aspects of our research and on the main results. Okay. The principal participants of this research were 53 affected family members of disordered gamblers in treatment for their gambling problems. The majority of the family members were females, and the mean age was about 50 years, with a range of the age comprised between 27 and 77 years. The family members were recruited in the north of Italy, that was the part of the nation most affected by the COVID-19 in this period. They were recruited by the health services in which the disordered gamblers were in treatment. The majority comes from the National Health Drug Services, but 15% of them were recruited at the association in which Daniela works, the no-profit association Azzardo e Nuove Dipendenze, Gambling and New Addictions. Concerning the educational level, the majority of the affected family members had a high school diploma, and half of the sample was employed. Most of them were married, and in terms of the kinship with the gambler, the majority were the spouse and the cohabitant of the gambler. The particularity of this research is that for 42 affected family members, among the 53 that participate in this study, we also recruited the relative in treatment for gambling problems. Who were these disordered gamblers? They were in treatment for the gambling problems, and most of them were males, consistent with the literature. They had a mean age of about 50 years, with a range comprised between 28 and 73 years. In terms of occupational status, most of them, about half of them, were employed, and the majority were recruited at the National Health Drug Service, but also from the private association Gambling and New Addictions. Half of the gamblers were in the middle of the treatment for gambling problems. In terms of their gambling habits, what we knew from the service in which they were in treatment for gambling problems, the majority of them, about 80%, were gambled on slot machines, and 98% of them were regular gamblers, that is, they gamble on a regular basis, so weekly or daily, and the totality resulted to be problem gamblers at the South Oaks gambling screen, with a mean score of about 11, so they were problem gamblers. To collect data, a semi-structured interview was specifically developed for this study, and it was conducted by the health care professionals that taking care the gamblers. Data collection occurred from May 2020 to the mid of June 2020, and questions were referred to the lockdown period. The interview lasted about 40 minutes, and participants were asked to respond after informed consent. This was for the family members. The interview, that was a telephonic interview, was divided into 4 sections. The first section was focused on participants' life conditions and emotional state during the lockdown period. The second was about the personal experience with the COVID-19 disease and attitude towards the national restrictions. The third part was related to the perception of gambling behavior of the relative in treatment for gambling disorder. So this part was focused on the situations that occur in the family because of the relative gambles, the coping strategies that the family members use to control and manage the relatives' gambling behavior, and the feelings with respect to gambling. And the fourth and final section was devoted to assess the expectations that the family members had concerning the future, specifically the feelings about the closure of gambling opportunities and the future easing of the restrictive measures. A semi-structured interview was developed for this study also concerning the disordered gamblers. It was conducted by the healthcare professionals. The data collection period was a little different, but referred to the lockdown period because it was from April to the end of May 2020. Again, the questions were referred to the lockdown period, and we collected the informed consent. Specifically, the interview that we realized with the disordered gamblers contained some of the same questions of the interview that we realized with the family members. You can see the sections that we administered in bold. We also administered again the South-Ox gambling screen to assess the gambling frequency and the gambling severity, specifically referring to the lockdown period, because the questions were framed as related to the last month. And we also included online gambling activities and private bets among the list of gambling activities. Okay, now I will show you the main findings. We begin with the family members. For the emotional state that they felt during the lockdown period, participants' responses were classified into different categories based on the reported words. Responses in which terms such as well, better, calm, serene, happy appeared were treated as indicating a positive general emotional state. You can say the green bar. Instead, the responses in which terms such as tired, bored, depressed, sad, and worried appeared were classified as indicative of a negative general emotional state. We can see that about 40% of the sample reported a general positive emotional state. However, the majority of the affected family members, about 50%, reported a negative state because of fear, anxiety, mood swings, and also concern for the reopening of slot venues. Although many respondents reported a general positive emotional state, as we can see from this figure, most of them described their emotional state as worsened with respect to the period before the lockdown period. Only 25% reported an improvement, and about 35% reported that the emotional state remained the same. Referring to the feelings about the closure of gambling opportunities due to the COVID-19, 60% of the sample, that is the majority, reporting being relieved because their relative in treatment for gambling disorder had stopped gambling. While 13% reporting being worried because of the patient's online gambling of the relative of gambling with gambling disorder, or because they were afraid for future reopening of gambling activities. There was also about 26% of the family members who declared to be indifferent because of the online gambling of the relative with gambling disorder, or because they did not thought about this thing. Concerning the perception of gambling behavior of the disordered family member during the lockdown period, we can see that the large majority, about 80%, reported that during the lockdown period, their relative did not gamble, and the majority report that the disordered family member did not have a gambling problem during the lockdown period. As for the emotional state towards gambling, participants' responses were classified into different categories based on their reported words, and most of the affected family members declare having a general negative state towards gambling, as documented by the terms they use: disgust, anger, hate. The other responses were classified as indifference, or being worried and afraid about gambling, or feeling compassion for problem gamblers. Referring to the predictions of what will happen once the COVID-19 restrictions will be lifted, as we can see, most of the participants were concerned that gamblers will relapse into gambling behaviors once the restrictions will be relieved. About 10% declared to think that the situation would not change, or they were worried about a worsening of the COVID-19 pandemic. Now I will present to you some results about the comparison between the affected family members and their relatives in treatment for gambling problems. First of all, it is important to highlight that during the lockdown period, gamblers reported to do not gambling during the last month. We can say from this figure that only 7% of the gamblers reported that they did some gambling activities during the last month. That is 3 persons, 3 gamblers reported to gamble, 2 on traditional or instant lotteries, and 1 on online gambling activities. But the frequency of gambling was not regular for these 3 persons, and the mean value at the SOX was very, very low. As for the emotional state towards gambling, 38% of the responses reflected a general negative state. We can see the terms used: disgust, anger, and hate. And there was a great proportion of responses indicated a state of indifference, and about 10% of responses indicated feeling guilty for gambling in the past. And the lowest responses indicate being worried about a possible relapse. Now we start with the statistical comparisons that we conducted between the responses of the affected family members and their relatives in treatment for gambling problems. The first comparison regards the perception of family relationships during the lockdown. As we can see from this figure, both the affected family members and the gamblers rated as quite good their relationships in the family, because the range of the score was from 1 to 10, and there was not a statistical significant difference. So the perception of family relationships, we can say that it was substantially equivalent among these two groups. When we ask if the family relationships were perceived as change from before the pandemic, again, we did not find significant differences between the groups of the family members and the group of the gamblers. However, if we look at the figure, we can say that for the affected family members, for the gamblers, the most predominant response indicate an improvement of these relationships, while this trend was not present in the affected family members, but there was not a statistical difference among these two groups. Among the affected family members, those who reported that familiar relationships improved during the lockdown period mainly attributed this change to greater family sharing, greater serenity, while those who reported that the family relationship were worsened from before the pandemic generally attributed this worsening to daily management difficulties. And the affected family members who perceive a stability in their relationship attributed this perception to the fact there were no changes, or because the relationship were already good, or because of the same problems and discussions. The relatives in treatment for gambling disorder who reported an improvement of their family relationships consider the same reasons as the affected family members, family sharing, serenity, but also introduce a new reason, that is the reduction of personal gambling behavior. The gamblers who reported a worsening of the family relationships during the lockdown generally attributed it to the restrictions related to the COVID-19 and also to arguments with the other family members. Those who declare no changes in this relationship generally reported that the situation was remained stable because there were no changes as the affected family members. Concerning the emotional state during the lockdown period, in this case, the statistical analysis indicate a significant difference between the affected family members and their relatives in treatment for gambling problems. And this difference was associated to a moderate effect size. That is, the difference is not only significant, but also quite big. We can say that the emotional state of the affected family member during the lockdown was significantly more negative than their relative with gambling problems. In fact, we can see that most of the family members' responses reflected a general negative state, while most of the gamblers' responses reflected a general positive state. We can see the words that the affected family members reported in support to the negative state: bored, depressed, sad, worried. While in this slide, we can say the words reported by the gamblers to support their positive emotional state: well, better, calm, happy. Also, considering the emotional state compared to before the lockdown, a significant statistical difference, and again characterized by a quite big effect size, was evidenced between the family members and the relatives with gambling disorder. In fact, the emotional state of the affected family members compared to before the lockdown was perceived as more negative than the perception of the gamblers. Among the affected family members, most of the participants reported that their emotional state worsened from before the COVID, while among their addicted relatives, there was a substantial equal distribution of the responses across the three categories, indicating an improvement, a worsening, or a stability of the emotional state. Both among the affected family members and their addicted relatives who reported an improvement in their emotional state, the majority attributed this improvement to greater family sharing or greater serenity, but the gamblers also cited the reduction of a personal gambling behavior. And among the family members who reported a worsening of their emotional state during the lockdown, most of them attributed it to a difficulty in daily management, while among the relatives in treatment for gambling disorder, the majority attributed it to the worsening of the COVID-19 pandemic and concerns for work and the future. Thank you very much.
Okay, I get to the general conclusions. What Marianna showed with all the data collected showed that during lockdown for affected family members, we could observe a general emotional state of stress, fear, and tension, along with the psychological consequences of the hard situation due to general lockdown restrictions. They showed a lower prevalence of a general positive state and a higher prevalence of its worsening subjective perception during the lockdown compared to their gamblers. And they didn't express a long-term experience of relief related to their gambler lack of exposure to gambling due to the lockdown. Compared to their gambler, they expressed a worse emotional state. They reported to feel worse compared to before the lockdown, and they achieved less serenity, although gambling land-based offers was mostly closed. So it's true that affected family members during the lockdown told us that they felt relieved toward the COVID-19 closures of land-based games, but the majority of them feared a relapse when the reduction of restrictions and the reopening would occur, even if in this period of gambling offer suspension, nevertheless, they showed an important presence of symptoms that remained unchanged compared to before the lockdown. They reported feeling worried, nervous, apprehensive, depressive, irritable. They also reported to feel even more fatigued than before the lockdown. What can be our take-home message? This study reconfirmed the severity of emotional and health harms experienced by pathological gamblers' family members who are not as much relieved as their pathological gamblers instead are, as a consequence of a lower pressure due to a reduced exposition to invasive gambling offers and triggers. It seems that their wounds remain open or with very visible scars. Passive gambling then is confirmed to have a traumatic impact and therefore is confirmed to be an important risk factor for the well-being of pathological gamblers, significant others. And we think this issue should become a concern in prevention and treatment implementation in countries such as Italy, where legalized gambling is authorized, with a specific attention to the quality of life of the affected family members. What we might do next. The disordered gambler's temporary abstention from gambling is not indicative of the well-being of the family member. Therefore, their specific needs must also be taken into account from the services. Taking care of family members not only as co-therapists, but as people in need of treatment and support for their specific needs, and families, so not just the gambler, is necessary. So services should orient their intervention not only to gamblers, but also specified to family members. And it would be good to act on the policies of supply reduction, self and hetero exclusion of the person with disordered gambling practice, because it was the perspective of reopening that made very harsh this time for affected family members. Thank you, and we think we stayed in our 40-minute presentation.
Thank you very much. You absolutely stayed in your time frame, and thank you very much for your brilliant presentation. And I'm sure there are several questions that might have came up. So I personally also would have some, but first of all, if any one of you have got a question to ask, just raise your hand or, well, turn off the camera and unmute yourself. I'm just having a brief look at the chat. 2 questions by Lorna Templeton. So, Lorna, just go ahead.
Hi, sorry, I was in the middle of typing, but I'll talk instead.
Yeah, that's better.
Thank you very much, both of you. That was really, was really interesting. My first question is, I think you said that the interviews were done by healthcare professionals rather than by members of your team. Can you say a little bit more about that and what kind of training you gave to them? And then my second question is, you've clearly identified that there were quite significant kind of differences between the gamblers and their family members. What are your thoughts on what could be done, I guess, at a broader level to kind of narrow those gaps and kind of differences in situations like that?
Okay, I could start answering for the about the first question. About the second question, I don't know if Mariana can answer or we can answer together. The first one about health professional and training that they received. It's important because in this study, the person who made the interviews were people who had in charge the family before the lockdown. And this is something very peculiar of this study because there was already a relationship, a therapeutical relationship, and it was not just a survey of someone unknown. So the training was not really a specialized training. The training was only limited to share with our colleagues all the questions to ask and why we were putting that question in a questionnaire in the interview that they were going to follow, but they were all trained staff. So they were already people who had in charge these persons. Actually, this was also a way during that time that it was not possible to reach the services in person to monitor and to understand what was going on with our patients. So we catch the opportunity of the research also to monitor their well-being because the services were closed physically, and so that we could in this way also maintain a link with them. So this, I think, is the answer of the first question. The second question, I'm not sure I understood 100%.
So Lorna, could you just repeat the second question once more?
Yes. Yeah, sorry, I just had to unmute myself. You identified that there were significant kind of differences in between the affected family members and their gamblers in terms of their emotional state and how they felt things were during the lockdown period. I guess, is there anything that could be done, perhaps at a societal level or an environmental level, to try to narrow that gap?
Uh,
A big question. Sorry.
Okay, I don't know, then after Mariana can introduce some other thoughts. So we really thought that this difference maybe, I underline maybe, um, reflects the fact that disorder gamblers felt relieved by the absence of the triggers and the stimuli to gamble, because they didn't find their offer. So slot machine, 80% of people, 90%, I don't remember, in treatment, in services for that kind of gambling. And at a certain point, slot machines were no longer available. So they felt relieved from an environmental protection. Someone told to Maurizio Avanzi, who's here, I feel like being in a big therapeutical community because there are no triggers to me. This was said by gamblers. Also, gamblers were gamblers in treatment interviewed by their professional referral, okay? Probably instead, this was not enough relieving for the family members because, and actually during the interviews, some of them told that they were sure that sooner or later, COVID will end, and so once again, triggers will come out again. So gambling will be offered another time, and slot machines will come over again, and bingo parlors and venues and every place where it's possible to gamble will be opening again. So this thought could not made possible for them to appreciate the temporary closure. Of course, there were situations of handling the consequences and damage of previous gambling to be handled during the lockdown. For instance, some people couldn't work and had some debt to be paid. So there were also some more things to make things more complex, but we really thought that probably it was the desperation that everything would come back like before COVID, so they could enjoy.
Okay,
I am
thank
in
you.
perfect agreement with Daniela, and I think that the key word to describe the affected family members' emotional state in this period is anxiety, because they are awaiting for the end of this temporal stability of the absence of the gambling behavior of their relative, but they know that there is the possibility that the gambler will start to gamble again. In my view, one aspect that they seem to not consider adequately is that online gambling opportunities are still available in this period, and as we can see, we have seen from the results, gamblers did not gamble online, and so this can be a positive point to underline to the affected family members.
Actually, there is also a question of Anita in the chat about gambling online, if it was improved or not. And maybe we can answer to this and then after listen to Richard. Actually, as Mariana said, online gambling in our sample of our patients did not improve. So they stick to their kind of gambling, which was not online. Improved only in the very few part of them who were already online gamblers or who were both gamblers, online and land-based. But who was only land-based gambler? No, they didn't improve online gambling. Actually, in Italy, it's important to be said that we have a law since 218, which forbids every kind of advertisement of gambling. Mm-hmm. So probably this protected during the period of lockdown people to be harassed by you could gamble online. So there was the lockdown, there was stay at home, and there was not advertisement of online gambling to suggest that maybe because you are at home, maybe you could gamble. So I think this could be very suggestive for a gambler who has stopped gambling because all the offer disappeared, but they didn't have these messages because advertisement is forbidden totally. We don't know what happened to people who was not in the services, so not patients. There are researches, actually money spent of online gambling raised, but not so much as industry expected to raise. So it's really complex, but to our people, our sample, no, and people in the services who were taken care of, no.
Thank you. So I think it's time to hand over to Richard for another question.
Okay. Thank you very, very much, Daniela and Mariana. A very clear presentation from both of you. I'm always in awe about people's ability to present in another language. So I think you did a fantastic job. Thank you. I have some observations as well as questions. You've answered, in a sense, one of my questions about why online gambling didn't increase. I think it's very interesting because even though there was no advertising about online gambling, I would have thought that people would have known that online gambling existed. So that there's almost a hypothesis that without the advertising, somehow people didn't get the trigger. And it's the trigger which is really important. So if they don't have the trigger, then although they may know at some level, there is such a thing as online gambling, and it's not difficult to find if you're connected to the internet. Somehow, because there was no advertising, there was no trigger, and that acted as a protection. So that's quite important. And indeed, it may be important if you are ever in the position of giving feedback to law agencies and politicians about how well if they ever wonder how well is it working, the fact that we have stopped advertising. This is actually some quite good evidence that in the absence of advertising, when people might have transferred from physical gambling to online gambling, they didn't do that. So I think that's really quite powerful information. I wanted to get your view really about this issue of all the affected family members, as I understand it, that you interviewed, had a gambling relative in treatment. And it seems to me that there's some very good positives about that, because the people who asked them the questions already had a relationship with them. And so that's a very, very good thing, I think, for doing research with people, where they'll give you probably much more honest, open answers. But obviously, it's a very small proportion of people with gambling problems who are in treatment. And these are people who are in the middle of treatment, and some people were quite far in their treatment journey. So it's I would like really your view about whether it's possible in any way to generalize from these results into what you think might be the case for people, for family members, and for that matter, gamblers who were not in treatment. Obviously, also, you've got the situation that the people who are interviewing the gamblers are their therapists. And there are a lot of subliminal pressures on people when their therapists are asking them questions about how they're doing, to report more positively than might actually have been the case. So I just wonder what you think about the situation that the gamblers were in treatment and they were being interviewed by their therapists, what you feel about generalizability of that to gamblers who are not in treatment and to family members of gamblers who are not in treatment. I've got other questions, but I'll stop there.
It's really hard to answer. I don't know if I understood right the question. Okay. Because the interview was a sort of a part of the treatment, I would bet that they would be sincere. Okay, because their objective, the main goal for them was, I know it could be a very tough moment for you, so we call you to know how are you doing in this harsh situation. You cannot come to the service, we can't see each other. Is it okay with you? There's something we can do to help you. So I think this was the environment of the research. So I would say they were honest, true, and sincere. We hope so. Same for the affected family members. They appear to be honest and to appreciate that someone was asking how they were doing. About the thing, how we could extend to people not in treatment, these results, thinking about affected family members, this made to me thinking that it's necessary to find a way they receive help. So it is true that there are only a few gamblers who go to a treatment, but it's also true that even less family members go to a treatment. So as Jim Orford said a couple of webinars ago, we still didn't get the way to have people with addiction in their family to receive help. So probably we should think how it's possible to arrive to this goal, but also knowing that they were staying so bad. Of course, there was a pandemic all over the world, but they really were bad. Make me feel that either they start to be considered by someone in the politics and in the sanitary service. Um, Otherwise, we can't change the culture. So I don't know how we can do it. AFINet is trying hard, 20 years, a lot of time, and still we are at this point. So this really questions me a lot.
Okay.
Thank you.
Thank you. So I think at the moment I just have another question, or it's a mix between a question and a comment, which just perfectly suits with what Richard just mentioned. I was thinking that in the end, given the patients you interviewed, at the same time you had two major changes in their life and in the life of their family members. One is the lockdown, the other one is them starting treatment with very low relapse rates. You mentioned only 3 people relapsed. So one thought that came up was that, well, probably the main issue you could show to a certain extent regarding the family members is that living under a lockdown is stressful. So they, you know, in the middle they showed signs of stress. And so I was wondering and I don't know actually to what extent the lockdown has influenced the course of the gambling issues. For example, one thing might be if the lockdown has led to reduced relapse rates, this, might have another effect. So one thing I was thinking, it might be really interesting if you would continue to do interviews like this after the lockdown in order to find out, is it really the closing down of the gambling venues, or are there other effects that might quite likely take place? Like if someone has gambled for years, and especially with gambling, there is a large amount of mistrust because usually family members, it's not such a visible behavior like drinking. And so, of course, they worry, well, the ice might be thin and people might relapse quite fast. So I would find it really interesting to see what changes take place once now after the lockdown, whether it's a universal experience of family members faced with problem gamblers while they are recovering. And of course, what Richard already mentioned, the issue of untreated gamblers might be as well important, as I just recall, I was reading something from Israel where the gambling participation online increased heavily during the lockdown. But of course, usually these are still active problem gamblers and not the ones who are into treatment. So yeah, I think the main questions is, what do you think about the problems of interpretation, and are you planning to continue to do similar interviews after the lockdown?
It's true that they conducted a follow-up will be the optimum, because we will be able to understand if something has happened beyond the closure of gambling activities during the lockdown. We could learn something new about this result. I don't know, Daniela, if you agree.
Yes, I agree totally. There are two problems, which of course are setting problems. The first one is that this research was not funded by nobody. So I know we have to talk about money, but this is it. So at that time, the University of Florence, Marianna, Caterina Primi, decided to participate with no support at all, of no money, 0 euro, first of all. Second, at that time, in the services, the professionals who were working in the service couldn't work other than by phone, and after by video calls like we are doing right now. So for them too, it was like something extraordinary to be done, because they could take some time from their working time that usually they do not have. Because right now patients are arriving, they have to do their stuff, so it would be very difficult. So we are totally we totally agree with you that this would be very interesting, but we unfortunately do not have resources to do that in the same way. So with no money and with the same persons that can take the time again to call all the 43 gamblers and all the 43 family members. And you can say both 43 plus 43 is not too many, but if you think that each interview was about 45 minutes, 1 hour, it is a lot of job. And unfortunately, people has to work in presence. So we are very, very sad about this, and we regret. This was a very, very, very big obstacle, for a methodological obstacle, but you know, it was like it was passing a train, and we decided to jump on the train in that moment, with the consciousness that that train probably will never pass again another time. And the other question, I lost it.
Well, I mean, actually, I think the topic now is even more interesting to me. So just in a brief other question, since you have a lot of experience with not only doing research on family members, but also on gambling issues, were you actually surprised by the results of this study, or was this something you have imagined, given your prior experience?
Daniela imagined these results. I remember that she hypothesized that, not very specifically on the comparison between family members and the gamblers, but she hypothesized that the family members would be very, very depressed, tired, stressed. So we could predict these results based on her clinical experience.
Mm-hmm. But I mean, actually, this would be something which is not specific due to the lockdown, you know. So I think the difficult issue you got on the one hand, you know, a certain safety during the lockdown that no land gambling is available. On the other hand, like I said, lockdown is a stressful event for everyone. And also, if we look at the stress strain information coping support model, you would assume that lockdown reduces, for example, social support.
Oh,
And
yes.
so, you know, it's very, very complex in the end. And it's a pity, of course, that funding is so difficult, not only in Italy, but as you mentioned, this project was, one way of self-exploitation. It's even more remarkable that you achieved so many interviews. Richard,
Yeah, just
you've got...
coming back, a couple of things. One is, and I understand absolutely the problems of doing repeat measure interviews, but it's a lovely idea to think about this group of people being a cohort that you can actually now have data on, and to think about doing a repeat measure, even if it's sort of once a year or once every 2 years, of going back to people. And it may well be that the services that you are working with actually have a system. I always think it's a very good idea if they do have a system where they follow people up after a certain period of time to check how they are. So it doesn't have to be a whole 40-minute interview. It could actually be a 15-minute telephone interview. But it's just so interesting that you have a cohort. And one of the things we suffer from hugely in our research is not having longitudinal cohorts. So much is cross-sectional, or if we're very lucky, we might have a 6-month follow-up. So it's something where you actually think, well, for the next 5 years, let's follow these people up once a year and see what happens. I understand the difficulties, but I'm just suggesting that it's a wonderful opportunity if you could find a way of doing it. The other thing I wanted to mention was that the thing that I found most striking, I think, was the difference in anxiety and concern about the possibilities of relapse. So your gamblers were saying, basically, I'm not gambling. Everything feels a lot better. I'm not worried about relapse. And the family members were saying, yes, there's been changes, but we don't think it's going to last. And somehow their anticipatory anxiety made it even worse than when they actually knew the person was actually gambling. So I'm interested in this juxtaposition of why it was that the family members could see into the future, and the gamblers. Is it something about people with many of these dependency type problems being much more responsive to immediate issues as opposed to longer term ones, and therefore thinking, well, I can't gamble, so I'm not going to gamble, and not thinking about the future in the same way as the family members? How do you interpret this big difference between anxiety about relapse and not anxiety about relapse?
Okay. Of course, is an hypothesis. About the gambler, we have to keep in mind that these people were already in treatment, so they had already a motivation to quit gambling. So it's like that this unavailability of gambling in that particular moment arrived just in time. So I decided to quit gambling, and gambling will not pressure me and trigger me every day of my life. You have to know that in Italy, gambling is spread all over. So you cannot go in a bar without having a slot machine in your back that's working. You cannot go to the supermarket that someone will give you the offer of a scratch card. So really, really aggressive. So I think this for the side of the gambler, the particular stage of life, motivation to quit gambling, and environment that suddenly becomes friendly for their motivations to quit. About the family members instead, I told you probably when we were in England, I really think that they have something similar to a PTSD. I really believe so. So this anxiety is really similar to the one that we find in people who had a big trauma. I really think that they were traumatized by gambling of their relative, and therefore the effect of trauma is not or no longer so connected to what's going on now, but it's connected to with what went on before, and it was a trauma. So really, I think that among all the offers and resources to family members, an evaluation of the traumatic disorder, post-traumatic disorder should be done, and eventually also a specific treatment, because I really had no more other hypothesis to guide what happened in this difference. Maybe I'm wrong, but really they look like they are very, very, very wounded in a very deep way.
Thank you.
I think the PTSD hypothesis is an extremely interesting one, and I've become much more interested in this area over the last few years, and seeing being an affected family member as being very similar to a very long-standing traumatic experience. And somehow we haven't linked together the PTSD world and the affected family member world. I think it's going to be a very interesting piece of work for us to actually link those together. Ale,
Alessandra.
And also gamblers, also when they are in treatment or the end of the treatment, they continue to lie. They can't stop lying. Also when they have no motivation to lie. This is a way to renovate the trauma. It's awful being always suspicious because they remain secretive. They don't speak. In our little research, we found that they at home, they didn't speak. They didn't talk about gambling during the pandemic and the lockdowns. So all was suspended, but also talking. It was good perhaps for gamblers, but not for family members.
Yeah, this brings me to another question that might also have influenced your research. I'm just interested if there are any opportunities for integrating relatives in the treatment of problem gamblers in Italy, or whether they are not.
If I can you hear me? Because I lost the connection. To the best of my knowledge, in Italy there are some pilot interventions with the family members. For instance, in the National Health Drug System in Florence, we conducted a cognitive treatment group for the family members, working specifically on them, and we worked on the cognitive distortions about gambling. So it was a strictly cognitive treatment, because we found that even the family members could have some erroneous cognitions about randomness, superstitious thinking, and so we worked on this. And also on their control beliefs about gambling in the relative. And we trying to work on these aspects. I don't know if Daniela had some other.
No, it's okay. I agree with what you found, and this links also to what Alessandra was saying before, that it's important for the family member to be guided into the pathology, because some erroneous cognitions can be shared. So it's important to work with both on this. So it makes sense.
Okay, wonderful. I'm having a brief look at the time, and I think we had now almost 40 minutes again of discussion, and I see no further open questions at the moment. So I would really like to express my gratitude to both of you for making this wonderful, clear presentation today. And of course, I am looking forward to see all of you in the real world, hopefully next year in Rotterdam. And like I said, we will open abstract submission hopefully this week. And certainly abstract submission will remain open until the end of February. So there'll be enough time, but while abstract submission is still open, you should keep in mind that next year on the 16th of February, we have our next webinar on craft and parent training delivered online, which will be data from a randomized controlled trial. But beside all of this, I just saw in the chat also that the issues raised by you about trauma and being an affected family members, they are quite appealing to many of the people here. So again, this would be a wonderful opportunity to use the conference next year to discuss this in further detail. And yeah, before this, I would like...
Gallus, let me just come in and say about that one of the things we'll be doing is opening abstracts for symposia or roundtable discussions. And it would be very interesting if some of us, Daniela and Mariana, and others, could think about putting in a symposium about the linkages between trauma and PTSD and trauma-informed work and affected family members of people with gambling and substance use problems. So that's, I think, a really interesting symposium. We could think about getting together maybe 3 speakers or a number of people to have a longer roundtable discussion like this, when we knew that we were specifically talking about trauma and PTSD and affected family members.
Certainly. And any other ideas are welcome as well. And you can see, you will have regularly updated information on the AFINet website. So, but before this, I would like to wish you all a happy festive season, a nice Christmas, and a happy new year. And hope to see you very soon in the next year, and hopefully in person next June. So thanks again for being here, and all the best for you, and see you.
Thank you very much.
Thank you very much, and have a peaceful holiday.